Ladies and gentlemen, please welcome Chairman of the Milken Institute, Michael Milken.
Good morning. Good morning. It was 1969 in Philadelphia, and Lori and I had moved back there in 1968 to go myself to graduate school, and Lori later to graduate school at the University of Pennsylvania. And I wandered over because I had heard about this young entrepreneur who was in the medical school at the University of Pennsylvania, who was entrepreneurial, innovative, and undisciplined. The kind of student that the professor wished did not ask all those questions. And he invited me to look at the work he was doing as he was moving along to become one of the world's leading neurosurgeons on a monkey that day at the medical school. And I knew within a minute or two that I would not be a doctor. As he opened this monkey's brain, after a few minutes, I had to excuse myself. I told him I forgot I had a class I had to go to. So I'd like to introduce you to a friend of more than 45 years and an individual that is changing the world in many ways for all of us, Dr. Neal Kassell.
That was good, Michael. Thank you, Michael. Slide's not changing. There we go. What if we could improve the health and happiness of countless people who are afflicted with Alzheimer's and Parkinson's disease, epilepsy, OCD and depression, tumors of the brain, breast, pancreas, prostate, and so on, using sound instead of or in addition to surgery, radiation, and drug therapy. It sounds like science fiction, like Star Wars, but it's not. It's something that's rooted in reality. And it's called focused ultrasound, which is an early stage, non-invasive therapeutic technology that has the potential, and I emphasize the word potential, to revolutionize therapy to the same degree that MR revolutionized diagnosis. Focused ultrasound is the most powerful sound you will never hear, but it's a sound that could save your life. An example, this is a 6-year-old girl who was struggling with incapacitating abdominal pain and renal failure as a result of this enormous tumor that was filling her pelvis. She was operated upon, but the surgeons had to back out because the tumor was too bloody. As a last resort, on a purely experimental basis, she was treated in one session with focused ultrasound, and more than half of the tumor was destroyed. In 2 days, her pain was relieved. In 2 weeks, her renal function returned to normal. The way it works is focused ultrasound, multiple intersecting beams of ultrasound energy are focused with an extreme degree of precision and accuracy on a point, on a target deep in the body. And where each of the individual beams goes through the tissue, it has no effect. But at that focal point where the beams converge, there are a large number of effects on the tissue, including destroying tissue, delivering drugs in extremely high concentration, precisely to the point in the body where they're needed, and thereby minimizing systemic toxicity or side effects. or stimulating the body's immune response to a tumor and enhancing or augmenting the effectiveness of the immuno-oncology drugs. The fact that there are so many different mechanisms of action creates the opportunity to treat a whole variety of medical disorders. And today, there are, in various stages of development, more than 80 indications. 10 years ago, there were only 3. The field is growing rapidly, very rapidly. In the panel session to follow this on things that will blow your brain, there will be more discussion of these neurological indications. Now, when you see a slide like that with so many indications, it sounds like snake oil, whatever ails you, good for whatever ails you. But to be sure, focused ultrasound is not a panacea. It's not good for every indication. It's not good for every patient. The problem is that the evolution of a new therapeutic technology from concept or idea stage to widespread utilization as a standard of care is a glacial process, often taking decades. There are a number of fairly daunting impediments, one of which is lack of awareness. Well, the Focused Ultrasound Foundation has the good fortune to have as a board member John Grisham, and he had the idea that he could use his storytelling ability and his brand to, in one fell swoop, inform all of the stakeholders in this complex ecosystem about the potential of focused ultrasound. And he did this by writing a short 44-page book that he says is the most important book that he's ever written. More than 800,000 copies have been distributed. It can be downloaded online from these sources.
I always thought of it being an older person's illness, and I've always seen people in wheelchairs, so I thought I was going to lose all my mobility. Basically anything that required movement, I couldn't do it. My leg would bounce uncontrollably. It would hyperextend and actually lock backwards. It was very, very painful. I couldn't walk, so I had to be taken in a wheelchair to the hospital. With each treatment, I could feel myself getting stronger and stronger. My symptoms were getting less and less, and my pain was getting less. Then the clinical trial director, she looked at me and she says, "Get up, you can walk." And I thought, I can walk. It was amazing. I got there in the wheelchair, unable to walk, and immediately following it, I walked to the room. It was a miracle. The focused ultrasound treatment has given me back my life. I've been able to go on walks. I've been able to run, being able to ride my bike again. It's a miracle.
So that's an indication of the potential of focused ultrasound. And focused ultrasound is a prime example of a futuristic, somewhat futuristic or aspirational, non-invasive therapeutic technology. Let me share another story with you, something that's closer in. Intracranial aneurysms are small balloons on the wall of arteries in the brain that are prone to rupture, often with devastating consequences. In 1980s, the diagnosis of an aneurysm was clinical once it ruptured, and the treatment was a big operation, a craniotomy to clip the aneurysm, and the patients often stayed in the hospital for several weeks. The mortality and morbidity from a ruptured aneurysm at that time was in excess of 50%. Today, as a result of advances in technology, aneurysms can be detected before they rupture non-invasively with MR or CT scanning. And they can be corrected with a simple outpatient procedure where a catheter is inserted into the aneurysm and the aneurysm is filled up with coils to secure it. And today, the mortality and morbidity from an unruptured aneurysm is less than 1% compared to more than 50% for ruptured aneurysms 3 decades ago. Now, in 1988, I met then Senator Joe Biden because we shared a mutual and deep interest in intracranial aneurysms. And in the 3 decades that I've known him, I've appreciated that there is no one who is more authentic or genuine or decent. He is the ultimate role model for inspiring young people to pursue careers in public service. Of all of his contributions, the most important is likely to be his impact on cancer. By virtue of his force of personality and his strength of character, and his absolutely unique ability to convene and motivate people and organizations and institutions, and his Cancer Moonshot initiative, he has made astonishing progress as an individual in a short time in changing the culture and rationalizing the fragmented, inefficient ecosystem of the cancer establishment, and thereby accelerating the care of millions of patients with cancer. Parenthetically, Joe Biden is the only politician in Washington that I'm absolutely certain has a brain. Because I've seen it. Welcome, Mr. Vice President.
Hey, folks. Good morning. Good morning. How are you, man? Good morning, folks. Thank you very much. Thank you. Thank you very, very much. I assume that's part of your morning exercise, having nothing to do with me, but thank you very, very much. My name is Joe Biden, and I'm married to that beautiful blonde woman that was standing next to me. Neal, thank you for the introduction. As my brother Jimmy Biden, who is here today, will tell you that but for Neal, I wouldn't be standing here. And he went in twice. The truth of the matter was he couldn't find a brain the first aneurysm, so he had to go on the other side and check it out. The first time I met Neal was after I had the operation. I never saw him, but he was the head of the Department of Neurosurgery at the University of Virginia. He got called in to cooperate with a great guy named Eugene George, the head of neurosurgery at Walter Reed, and so my brother and my son said, "You got to meet him." I mean, he had already saved my life. And I remember rolling down, Neal, you may not remember this, rolling down the first time into the operating room after you docs told me I should say goodbye to my sons, and not goodbye, hopefully I was going to see him again, but you weren't so sure. And I remember looking up, and the anesthesiologist is behind me, and you go down, you count the tiles on the ceiling, as you're going in. And I said, "What are my chances?" And the doctor looked at me said, "Well, they're good. They're good." I said, "What are they?" He said, "About 30%. They're really good." I thought, "What the hell, man? This is really, I'm riding high. It's 3 in 10. I got to be one of them." But anyway. The funniest part of this is, and I'm taking too much time away from the important subjects here, but my son said, "Look, you got to meet Dr. Cassell. You've not actually had a chance to speak with him and spend any time with him." I was recovering. I was up and out of the hospital. And so we met him at a restaurant. My son said, "I've arranged to meet at such and such a restaurant." I walked in, and Neal stood up and they said, "Dad, this is Dr. Cassell." And I said, "Doc, thank you so much." He looked at me, he said, "You remember this, Doc?" He said, "What do the angels sound like?" I said, "What the hell is this guy talking about?" He said, "You were dead for a little bit." Anyway, bring back a lot of good memories, Doc. Bring back a lot of good memories. Holy God. I'd rather be on the stage with him than the operating table with him. Look, and Neal's efforts on ultrasound are really worth you taking a look at, those of you who are not in the medical field, and determining whether or not you should join this effort is pretty mind-blowing.